Good afternoon, everyone. I think we can get started. Thank you so much for joining us. My name is Melissa, and I am the Director of Member Engagement at the AMA, and I will be your moderator for our news conference this afternoon. Before I turn it over to Dr. Duggan and Dr. Wong, I'll just take a minute to read the AMA's Land Acknowledgement Statement. Next slide. Oh, thank you. The AMA respectfully acknowledges that we are privileged to live and work on the traditional lands of diverse, distinctions-based Indigenous peoples, including the Anishinaabe, Dene, Nehiyawak Cree, Niitsitape Blackfoot, Otipemisiwak Métis, Sioux Nakota, Stoney Nakoda, Tsuut'ina, and more. This land has been gifted with many names, including Treaties 6, 7, and 8, the Métis Nation within Alberta, its Otipemisiwak Métis government, and the 8 Métis settlements and its Métis Settlements General Council and the homeland of the Métis. The AMA honors the vibrant histories, languages, and cultures of the First Nations, Inuit, and Métis peoples of Turtle Island, now known as Settler Canada, who came before us and continue to thrive here today. So with that, I will now turn it over to Dr. Shelley Duggan, President of the Alberta Medical Association, and Dr. Sam Wong, President of the AMA section of Pediatrics. Please go ahead.
Good afternoon, and thank you for being here today. More than a year ago, the AMA gave Alberta Health an acute care stabilization proposal to address key issues that our members are grappling with. These are issues that hinder our ability to retain Alberta physicians, attract new talent, and ultimately care for patients in the way that we would like and in the way they deserve. Alberta's acute care system is under immense strain, but physicians do have solutions. This event is the 5th in the AMA's Acute Care Concern series that we started last year to highlight various parts of our acute care system. So far, we have showcased the specialties of cancer care, general surgery, general internal medicine, and obstetrics and gynecology. Today, I'm pleased to spotlight my pediatric colleagues who are affected by many of the common issues outlined in the stabilization proposal. Pediatricians play an integral role in child health and development and help prevent chronic illness in adulthood by catching problems early. Their skill sets are broad, and they deliver specialized care to children from infancy to adolescence. Quality pediatric care is a cornerstone of health services, but pediatricians are facing mounting pressures every day, and Alberta is at risk of losing more of these specialists to retirement or other provinces. I will now turn the microphone over so that we can hear from Dr. Sam Wong, President of the Section of Pediatrics.
Thanks, Dr. Duggan. There are many issues that are top of mind for pediatricians right now. I believe our media team will share a profile with all the details, but I will go over the key topics in my comments. First, Alberta's booming population means more children need care, but the number of pediatricians has not kept pace with the number of patients who need us. Many pediatricians face burnout as we try to keep up with demand. Along with the overall population increase, we're seeing more children with complex health needs, such as kids who are born premature, and these patients tend to need more care and more time with us. Pediatricians often work into the evenings and weekends to finish paperwork and charts, which are important for good patient care. However, each patient visit can require up to 30 to 60 minutes of paperwork and/or follow-up tasks, but this work is unpaid and puts more strain on pediatricians, especially as our patient numbers are constantly ticking upwards. Along with increased patient volume and care needs overall, we're also seeing a much greater need for children's mental health and developmental care. Right now, children are waiting a year to 18 months to see a mental health practitioner, even with a referral, because of high demand. This includes kids with addictions, and there are limited resources for them in the province. It's also common for a child to wait more than a year to be diagnosed with a learning disability, a behavioral issue, ADHD, autism, or other conditions. These diagnoses are a critical part of supporting kids to succeed socially and at school, and long wait times put tremendous strain on parents and families. We try our best as pediatricians to help while they wait, but we do not have the bandwidth to do this as well as we would like, and pediatric subspecialists are critical for our diagnosis. As pediatricians, we got into this field to look after kids, and it's tough to see them going without the care that they need. My colleagues feel enormous moral distress as a result, which really intensifies the burnout they're already experiencing. So overall, it's becoming harder to sustain excellent pediatric care due to high demand, and this is compounded by the fact that we don't have enough pediatricians in Alberta. Changes to on-call payments means fewer rural pediatricians are willing to do on-call shifts and after-hours hospital work. Because of this, children wait longer for care, and sometimes they need to travel long distances to see a pediatrician at an urban hospital. The on-call stipends for overnight and weekend care don't reflect the demands of this type of work, and we've heard there are plans to decrease the stipends further. Many pediatricians are avoiding or leaving hospital work altogether because of this. All these factors contribute to the waning interest among pediatricians to train, work, and stay in Alberta, making human resources issues even worse. We also know there are not enough pediatricians to replace the ones that are retiring, especially in rural areas that are already stretched thin. We will have a crisis in the next 5 to 10 years, especially in rural areas, if we don't do something to retain and hire pediatricians in Alberta. And it's not just a shortage of pediatricians we're grappling with when it comes to caring for children. We're also facing a shortage of support staff, such as speech language pathologists, occupational therapists, mental health counselors, and dietitians who are integral to quality pediatric care. Patients used to be able to see one of these professionals within the month of being referred. It now takes 3 to 4 months or longer, and these long wait times leads to worse outcomes for kids and families. On top of that, there are not enough dollars allocated to programs like home care, FSCD, and PUF. So kids with complex needs like learning and developmental disorders wait longer than they should for specialized supports. Having support in school from an educational assistant, occupational therapist, or speech language pathologist can mean the difference between succeeding in school or being held back. They also support healthy social skills, which are essential to overall well-being and thriving in school. Without access to these professionals, we see complex kids suffer academically, socially, and often physically. So as you've heard today, there are a number of issues that pediatricians have to contend with right now, but there are steps we can take as a province to mitigate them. The first is to support pediatricians and recognize that the care we provide can cultivate better health outcomes throughout childhood and into adulthood. Something as simple as promoting vaccinations, especially during this measles surge, makes a world of difference. We really appreciate the Minister of Health endorsing 2 doses of the measles vaccine for everyone, and the ministry's continued support of the immunization programs. But we miss the days when leaders would get their photos taken of themselves receiving their shots and take every opportunity to actively promote vaccines. It would be great if we could also work together on a comprehensive plan to combat the viral surge that happens every winter. The surge is predictable, and there are lots of things we can do to prepare. I'd also like to see fellowship opportunities created to help physicians deepen and expand their skill sets and gain confidence. This would also help pediatricians feel much more comfortable working in rural areas, which is a unique skill set in its own. We also need to increase funding for children's mental health, including addictions care, to make sure kids can access these services when and where they need them. And we need to increase funding for support staff such as allied health, nursing, and clinical assistant staff to make sure kids in Alberta receive well-rounded care. And finally, we need to incentivize pediatric work in Alberta to make sure our kids can access timely care. This can be done in part by increasing compensation to encourage more new pediatricians to enter the field and offset clinic overhead costs, which have increased steeply with inflation. That concludes my comments, and I will now turn the microphone back to Melissa to open up for questions. Thank you for being here and listening.
Thank you, Dr. Wong. Okay, so we'll conduct our Q&A today just using the hand raise tool in Zoom. If you've got a question, please just press that hand raise button and we'll go in the order of hands raised. I don't see any just yet, but when I call your name, if you want to ask a question, please just come off mute and let us know, your first name and the media outlet that you're with. That would be helpful. Don't see any just yet. Thank you, Matt. Matt, please go ahead.
Hi, thanks for taking our questions. Matt Skase, Canadian Press. I'm wondering if you could get into a little bit about the most recent impact of these shortages you're highlighting. Like, what exactly has this looked like in hospitals, maybe during the most recent flu season, for example, and what this means for families and children?
Well, I think this past season and the last couple of seasons have been extremely tough for pediatricians and the ancillary healthcare workers like nurses and emergency departments. But also, I mean, I think it's been really hard on families and kids. The numbers have been incredible. I mean, we were looking at numbers in that Alberta Children's Hospital where they were well over the capacity at 140% at times. There's a lot of moral distress when you can't provide the quality care that you're supposed to be providing. It also means that there's a bed backlog, right? You just don't have enough beds to to bring patients in. They get stuck in emergency. That results in longer wait times. So during the viral surge, there were waits of 6, 8, 12 hours for kids to be seen. And that's not safe either. Like, you don't need to be having kids wait 12 hours to be seen, especially if they have a viral illness that may be causing respiratory symptoms. And there is always the risk that a child will decompensate in the emergency waiting room and actually have an outcome that is catastrophic because they were not able to be seen in a timely fashion. So I think from that point of view, it's really distressing from the pediatrician's point of view, the healthcare workers' point of view, but it's tough on the parents because they're worried about their child and the child's suffering and they can't get seen. And sometimes it's just to be reassured that their child is fine. But other times it's to make sure that, that they get a bed and they get the care that they need.
Thank you for that. Also talk about the crisis in the next 5 to 10 years in rural areas. Can you sort of describe what that means in more detail? Like what rural areas might be up against if that comes true?
Yeah, there's a group of pediatricians that are working in rural areas like Medicine Hat, Lethbridge, Grand Prairie, Fort McMurray that are getting close to retirement. And that's, I mean, that's the fact of life. They're getting close to retirement. Then pediatricians that are coming out now don't feel necessarily comfortable going into these smaller centers and working on their own, dealing with the wide variety of pediatric diseases that you have to deal with in these areas. You might have to resuscitate a newborn, and then you have to take care of a kid who has ADHD, and then you may have to be in emergency taking care of a 2-year-old who has respiratory distress and may need to be intubated and have ventilation, and then making arrangements for them to be transported to Edmonton or Calgary. It is a unique skill set, and it's important, I think, for politicians to realize that it is a unique skill set, and this group of pediatricians who have that unique skill set are retiring, and we're not doing enough to give confidence to new grads to go out in these smaller areas. So I think that the key is actually giving some extra training to new grads, 6 months to a year, where they do extra skills, gain extra skills in like NICU, mental health, behavioral pediatrics, and going out into these smaller areas with backup by the pediatricians to do call and realize that they can actually do it. And that way we can recruit these pediatricians into smaller areas and replace the pediatricians that are going to retire in the next little while. And I think it's going to be a crisis in these small areas because it's hard to encourage or recruit new pediatricians into these areas because they don't feel they have the confidence coming out of residency. When they probably have the skill set, it's just more of a confidence thing. And the fellowships would allow that to develop.
Thank you. I don't know if anybody else has questions. I might have a few more, but I can see for now.
I don't know. That's okay, Matt. Thank you. I don't see anybody else. Please go ahead and raise your hands if you'd like to ask anything. Matt, in the meantime, if you've got another question or you want to follow up, please go ahead.
Sure, I'll go ahead. There's a note in the press release here that would like you to expand on. It says political interference and clinical autonomy when caring for children and adolescents. Could you just expand on what that means?
Well, and that's specifically talking about the legislation, the 3 pieces of legislation that the Alberta government has introduced. I would call targeting. They would probably say directed at transgender children. And it really interferes with the relationship that the pediatricians have with the parents and the patient. I think, and there's lots of physicians who believe the way I think, that there is no role for the government in the examination room along with the physician, the parent, and the child. These pieces of legislation have now told us how we can practice, how we're supposed to practice when it comes to transgender children, and is not necessarily based on scientific proof or evidence. And so that, I think, is the problem that we have with these pieces of legislation. It's also targeting a population that is only 1% or less of the adolescent and pediatric patient population, but there's 3 pieces of legislation directed at this group, which I don't really understand why they're targeting this group. So that's really what we're talking about when we're talking about interference with medical therapy and interference with our ability to practice medicine.
Okay, thank you. Is it okay if I just keep going? I just have a few more.
Yep, I don't see any other hands raised.
Okay, thank you. I've heard from doctors about morale, and I'm wondering how much of, I guess, hospitals and other groups functioning relies on goodwill of doctors, and if morale has sort of, I guess, impacted doctors' desire to serve in those sort of volunteer roles or work extra, et cetera, et cetera.
Yeah, I think it has really made a difference. It's harder to get people to volunteer to do things for the hospital, leadership roles, to participate in organizing things as a pediatric group. And it's harder to get them to come out and actually do things off the side of their desk. There's also the morale of the weakening morale that also affects your willingness to go to work. Like, I like my job. I'm a pediatrician. I like going to work. I enjoy going to work. The hardest part of my day is actually getting out of bed in the morning because I enjoy what I do. And I use this term loosely, but the soul-sucking part of my work is actually having to deal with administration or deal with the moral distress I see where I can't actually do something for my patient that they need. They might need mental health counseling, and I do the best I can, but I'm not a mental health counselor. And that part is really distressing for a lot of pediatricians when we can't help the patients that we see in the way that they need to be helped. And that's really hard for us as pediatricians. We went into pediatrics because we care for children. We like children. We enjoy the medicine of children. We enjoy the satisfaction of taking care of children that most of the time get better. And when they don't get better, sometimes because of system problems, it's hard for us. And that's the difficulty, I think.
Thank you. I think that's all for me for now.
Thanks, Matt. Okay, I suppose with that, I would say maybe going once, going twice. I don't see any other hands raised. All right, well, thank you. Thanks so much for joining us today. If there is any follow-up or anybody has questions or any other requests, please just reach out to media@albertadoctors.org and we'll follow up with you directly. Other than that, have a great afternoon and thanks again for the interest.
Thanks.
That's all.